The first step is to ensure you are well prepared. Please watch the Central Line Care preparation video before you start. Gather your supplies. To change the dressing for your child's central line, you will need hand sanitizer, 1 sterile transparent dressing. Make sure you have the proper dressing for your child. 2 chlorhexidine or alcohol swab sticks, depending on what your child uses, and 4 to 5 alcohol swabs. You may also need adhesive remover swabs, Cavalon no-sting barrier swab sticks, waterproof tape, and a safety pin. Prepare your child for the procedure. Make sure you are both in a comfortable position and that you have easy access to the line. Wash your hands using soap and water for 1 minute. Make sure you scrub your hands well and dry them with a clean towel or paper towel. Clean the tray or surface you will be using to set up the supplies. Prepare the supplies on the clean work surface. Starting with the dressing, open the packaging and keep it open like a book. With the dressing on one side. This will be the dry side of your workspace. Then, open the swab sticks and place them on the opposite side from the dressing itself. This side will become the wet side of your workspace. Open the alcohol swabs and stack them up on top of each other on the wet side. If required, open the Cavalon no-sting barrier swab sticks. Keep these in their packaging on the side of your clean surface to keep them moist. If required, open the adhesive remover swabs and place them onto the work surface. Since you have just touched a lot of packaging, it is important to wash your hands again. You can use sanitizer if you have some at home. In preparation for the dressing change, remove the backing of the dressing. Remove the old dressing, starting with the strips crisscrossed over your child's line. Remove the outer edges toward the exit site, where the central line comes out of your child's skin. If you stretch the dressing and keep it close to the skin, it can help with removal. If your child prefers using adhesive remover, you can use that as well. Just make sure the adhesive remover does not come too close to the exit site. Using an alcohol swab, anchor your child's line at the exit site by holding it as close to the skin as possible. With your other hand, Take another alcohol swab and clean the line away from your child's skin towards the clamp. Keep holding your child's line off the skin and clean the line for a second time with a new alcohol swab, but this time without the anchoring at the exit site. The line must now dry for 60 seconds, but you can move on to the next step while you wait for the line to dry. It is important to be sure that nothing touches the line now as it is cleaned, and it remains lifted off the skin. While holding the central line off of your child's skin, pick up a chlorhexidine swab stick. In your mind, divide the area of skin that is going to be under the dressing in half. With the first swab stick, use a back and forth motion to create friction. Clean one half of the skin area horizontally. Clean for at least 15 seconds. You will then flip the swab stick over and clean the other half of your child's skin going horizontally for at least 15 seconds. With the second swab stick, you will repeat the same process, but going vertically, up and down, across your child's skin. You will then flip the swab stick over and clean the other half of your child's skin going vertically for at least 15 seconds. Keep holding your child's line off their skin and allow the area to air dry for 1 minute. If your child needs to use the green sticks, then you must wait 3 minutes for it to dry. Do not blow or wave your hand to try and speed up the dry time. If your child requires the Cavalon skin prep, once the skin is dry, apply the Cavalon on the skin where the new dressing will be placed. Be sure to avoid 1 to 2 centimeters directly around the exit site of the line. Once applied, allow the Cavalon to dry for 30 seconds. Make sure your child's skin is completely dry by looking at your child's skin from different angles to see that there are no wet spots left. If you put on the new dressing before the skin is dry, this may cause a rash. Once the skin is dry, coil the line to prevent any pulling or tension at the exit site. You may need help from your child or another caregiver to hold the catheter in place while you apply the new dressing. Make sure they wash their hands and hold the cap to keep the line still. They should not touch or hold any part of the line that was just cleaned and that will be covered under the dressing. If your child is able to stay very still, sometimes the lines will stay in place on their own and you will not need an extra pair of hands. Apply the sterile dressing by laying it flat against the skin with the exit site as close to the middle as possible. Make sure you don't stretch the dressing when you put it on your child's skin. Peel off the top paper layer of the dressing. You can use the little white strips to do a crisscross method around the line below the dressing to keep it secure. You can also just simply lay them flat over the line where it sticks out from under the dressing. The important thing is to make sure the dressing sticks to the skin and there are no openings. If you need to, you can use waterproof tape to secure the line further or to help safety pin the line to your child's clothing. Be careful not to poke through your child's line. You are all done. Make sure you ask your nurse if you have any questions about dressing changes.